Let's learn about the 5 R's motivational intervention. This approach is designed to motivate tobacco users who are unwilling to quit at this time. With the 5 R's, you will use your motivational interviewing skills to soften resistance and evoke change talk. The 5 R's are relevance, risks, rewards, roadblocks, and repetition. Let's take a look at each of these. Let's start with relevance. Encourage clients to indicate why quitting is personally important to them. Motivational information has the greatest impact if it is relevant to a patient's disease status or risk, family or social situation, such as having children in the home, health concerns, age, gender, and other important patient characteristics, such as prior quitting experience or personal barriers to cessation. Risks. Ask the client to identify any potential negative consequences of tobacco use. Emphasize that using low-tar, low-nicotine cigarettes or other forms of tobacco, such as smokeless tobacco, cigars, and pipes, will not eliminate these risks. Risks include acute risks such as shortness of breath, harm to pregnancy, long-term risks such as heart attacks and strokes, and environmental risks such as increased risk of lung cancer and heart disease. Rewards. Encourage the client to identify potential benefits of stopping tobacco use. Highlight the benefits that seem most relevant to the patient. These might include things such as improved health, better tasting food, improved sense of smell, saving money, feeling better, setting a good example for children, better smelling home, car, clothing, breath, and many others. And remember, quitting tobacco is one of the healthiest decisions a person can make. Roadblocks. Ask the client to identify barriers to quitting and note elements of treatment, problem solving, pharmacotherapy that could address those barriers. Typical barriers might include withdrawal symptoms, fear of failure, weight gain, lack of support, depression, and enjoyment of tobacco. When a client expresses resistance, use reflection, express empathy, and ask permission to provide information that might help them. Repetition. The 5 R's motivational intervention should be repeated every time you visit with an unmotivated client. The goal is to evoke change talk using your motivational interviewing skills. Let's review the 5 R's motivational intervention. The 5 R's are relevance. Help your client connect the importance of and reasons for being healthy to the decision to stop using tobacco. Risks. Help your client identify risks and negative consequences of using tobacco. Rewards. Help your client identify the benefits of quitting tobacco use. Roadblocks. Help your client identify any barriers that would prevent them from quitting. And repetition. Ask client to talk about their tobacco use at every visit in an attempt to evoke change, talk, and build momentum towards quitting.